I'd like to welcome Dr. Amy O'Brien to this podcast on skin. She is a GP with a specialty in skin management or skincare, and we're going to talk about what can happen to your skin after pregnancy loss. But I just want to point out that this isn't medical advice. This is just us going through and explaining why it's happening. So thank you so much for joining us, Amy.
That's my pleasure, Peter. No worries.
So I suppose one of the things that we forget about is that our hormones are all over the place. And if you think of even when you were a teenager, whenever your hormones were all over the place, your skin was all over the place. So I suppose that's really what I wanted to talk about.
After a pregnancy loss, there may still be lots of changes in your skin and your nails. It can take time to settle. There can be visible reminders of the shifts that your body's had to go through. So while it might not be painful, you're still left sort of wondering what's going on and how long they'll take to go. Sadly, there's not a lot of research on any of this after pregnancy loss. We know that they're linked to hormones that affect your blood flow, skin pigment, and your nail growth. And these systems, they all take time to adjust after pregnancy loss.
It's really interesting when we were looking at it that it can go either way. So you can get dry skin or oily skin. So there's no one size fits all.
That is absolutely right. Your skin will generally go one way or the other. It usually feels pretty different from usual. It might be dry, it might be flaky, it might be itchy, it can be linked to lower oil production. But other people, they become really oily, mainly on the face, and it might be sort of this greasy feeling. It might be breakouts, can be around the chin, the jawline, sometimes the upper back as well. It's all part of your body's hormonal adjustment. It does generally improve slowly with time.
The other thing that I have noticed a lot is blemishes and little veins, and we know that little veins come up on your breast, so we've done a whole episode on the changes in your breast, but you can get those marks on your face as well.
Yep, that's exactly right. There are actually lots of changes that happen with pregnancy. So, the little veins across your chest and your body, the blemishes on your face, you often get, if not acne, you get pigmentation on your face. Your skin is really, really sensitive to hormonal changes on the face during pregnancy. So, it might be pigmentation that fades when a pregnancy finishes. However, it might be pigmentation that actually sticks around and can be quite resistant to treatment, and that can be a problem. Other than that, you can get all sorts of other things. The pigmentation isn't just limited to your face, unfortunately. So you'll get darkening around your nipples as well. You might get that little dark line down from your belly button called the linea nigra. And you might even get pigmentation on the inside of your thighs. So lots of things that are going to happen, but most of it will settle.
I noticed that sunscreen can really help with that, or not making that pigmentation darker.
Absolutely. I mean, my advice to most people for almost everything is sunscreen. It is your best researched product for the face, and it works on pigmentation on the face, hands down. So it can be a UVA, UVB, or what we call a chemical sunscreen. You can also use a tinted sunscreen, often a tinted physical sunscreen, and that helps protect visible light, which is one of the primary things that affects pigmentation. But it's not even talking about just sunlight. You're actually also talking about a bright screen. So as soon as you wake up in the morning and turn on your phone, that bright light on your face can affect your pigmentation if you've got the pigmentation called melasma, which is a problem.
I did not know that. That is really interesting. I had no idea.
Yeah, that's a problem. That's when you really need to see someone and get some advice on what you're doing. If it's normal pigment, you might find it will just fade away with time. Normal sunscreen, all good.
I know that it's a very generalised comment. If you are really oily, is there anything that you recommend staying away from or doing?
Really, you want to try and decrease your oil production. Some people stay away from moisturiser, which is not the answer. You actually need to regulate your skin. So if you're really oily, you will probably use something like a salicylic acid cleanser or wash, and that will decrease some of the oil production. You might add in a retinol or a vitamin A, which helps with cellular turnover and helps settle your skin down. And then just really gentle, basic moisturiser. And in doing that, it might take a few months, but that will hopefully bring your skin back to a normal level.
And from the polar opposite, if we're talking about a woman when she gets the dry skin, what's your advice around that?
Hydration. So a gentle cleanser in that case. You don't want anything too stripping because your barrier or your skin is already impaired. So a really gentle cleanser. You might add in a niacinamide, which is an anti-inflammatory, non-irritating product, usually a serum, otherwise known as a vitamin B, and then a good gentle moisturiser over the top, and then your sunscreen, one that isn't going to irritate your skin too much, which might take a few different ones to try, but most people can find a sunscreen out there that they can cope with.
The other thing you touched on at the start, and that we know there's no real research around this, is nails. So what would you advise people? Like, your nails become so different during this period. They will change with time, but when would you advise them to go and see a doctor?
Yeah, so I guess it depends what you're noticing, but often, you'll notice your nails have grown faster during a pregnancy period, and that will settle itself down usually, and you might get a few white spots and ridges. But your nails are soft, which is not uncommon during pregnancy, but if they split and they're soft and they keep doing that for a number of months afterwards, you'll probably go and see your GP. You've got to do a check for things like thyroid disease, just to make sure that all your hormones have come back to normal. Most people have probably been in contact with their GP or their obstetrician during that time, and they're probably keeping an eye on those things anyway. But if things are prolonged and not improving, that's probably about the best advice.
And the same with skin. When would you say to start to come and see someone like you instead of just trying to manage it on your own?
So you'd try all the basic things first. Hydrate your skin if it's dry. Try and use, salicylic acid and retinol if it's really oily. Give everything a couple of months. Nothing happens fast with skin, and if you start chopping and changing and thinking something's not working after a week or two, you're going to get yourself into a real mess. So if you can tolerate picking the products you're going to use, sticking with it for 6 to 8 weeks. If things aren't working then it's not a bad idea to check in with someone who's got some knowledge on skin, whether it be your GP, whether it be a skin clinic like ours, just to make sure that you are on the best things for your skin.
Okay. And do you have any other tips that you would give women during this period?
Be kind to yourself is the biggest thing of all. Things do take time. Bodies do change a lot, and it does take time. Things like, don't jump in a hot shower and don't try and scrub your skin, whether it be dry or whether it be oily. People do it for both. Just use gentle products as a general rule. Don't use anything fragranced. That can often cause irritation. If your skin's flared, you want to keep things pretty well settled. Yeah, and don't chop and change, I think. Just stick to something for a couple of months before you decide what's working and what's not working.
I think that's probably one of the best bit of advice I've heard around this sort of topic, because I know how easy it is when something's not working to change it. I don't think people realise how big an impact it can be by just going, well, this product's not working, so I'll flip to this product. So I think that just trusting in the product that you've chosen is a great idea.
Absolutely. And it doesn't have to be fancy. Doesn't have to be expensive. Doesn't have to be fancy. There are lots of really basic products out there that will do the job. It's just, trusting what you've chosen and then sticking to it for a little while.
Thank you so much for making the time to talk to us about this. We really appreciate it.
Peter, that's my pleasure. Really happy to.